Well, I hope you learned how to wash it properly, talking about your hands, because I just did. So let's have that discussion on World Hand Hygiene Day. We have in the studio Madam Tochi Okwa. She's the head Department of Disease Prevention and Health Promotion from NCDC. Thank you so much for joining us, Madam Okwa.
Thank you for having me.
Okay, it's World Hand Hygiene Day. And this is one hygiene practice people could just see as very simple practice. But tell us how critical it could be when ignored.
Hand hygiene is actually one of the most important, one of the most impactful, and one of the most cost-effective ways that we can prevent the transmission of infection from one person to the other, whether it is in the healthcare facilities, in communities, in our homes, or in our schools. And it is so important that it has been given a whole day on its own. May 5th every year, WHO and indeed the whole world, particularly the people in the health profession, come together to mark what is called the World Hand Hygiene Day. The whole idea is that every day of the year, 365 days in a year, every health worker should practice hand hygiene at every point of encounter with patients in the health facility. But we mark the day, taking aside the 5th of May, to get everybody's consciousness, to mobilize all stakeholders, and to refocus and bring back to our consciousness how important this singular act is. Because it is hand hygiene that will prevent the transmission of infections from one person to the other, as I've said. But more importantly, it prevents the transmission of what we call drug-resistant organisms. You must have heard about antimicrobial resistance and how it is impacting the whole world and really risking going back to what is called the pre-antibiotic era. But hand hygiene, if properly practiced at what we call the points of care, the moments that every health worker must keep their hands clean, if it is practiced consistently using the right technique and the right timing, as you have seen being demonstrated in that video, it has been shown that it can really reduce the transmission of infectious diseases. So,
talking about these infectious diseases, we saw that reorientation, came alive during the COVID era, and also when there is this campaign for Lassa fever, prevention against Lassa fever. That's when people get that consciousness. Is the, agency looking at other strategies to bring that consciousness beyond the celebration of today that hand hygiene is very important?
Yes.
Okay.
So in Nigeria, we have what we call our National Infection Prevention and Control Program, and it does have a name. The name is Turn Nigeria Orange, and we have what we call our implementation strategy, which is through the Orange networks, and the philosophy, which is One Nation, One Plan. And the whole idea is that we want to work together as critical stakeholders in the health system, starting from policymakers to managers of health facilities, to all the health workers, down to the health workers that operate in the community, to make sure that everybody is organizing for what we call infection prevention and control, the bedrock of which is hand hygiene. And this goes on every day in Nigeria. We have our network of health facilities. We have our network of what we call health facility, Ministry of Health focal persons in every Ministry of Health in Nigeria today, including the Federal Capital Territory. And part of their main duty is to continue to support their colleagues, the frontline health workers, to continue to practice hand hygiene. But then a day like 5th of May is just a day we bring it to spotlight it, to bring it back to everybody's consciousness. But it is what goes on every day, each time a health worker interacts with a patient in the setting where healthcare is provided. And that is what at the NCDC, as a National Infection Prevention and Control Program, we continue to build the capacity of our colleagues down to the subnational, to every health facility in this country. We continue to identify their needs. Are there infrastructural challenges that need to be overcome? We work through advocacy. We work through helping them to think through the ways to overcome those obstacles. We also realize that if people are not competent individuals IPC professionals are not manning infection prevention and control programs in health facilities in the country, it will be very, very difficult to achieve not only hand hygiene, but all the other practices that health workers need to adhere to.
Beyond the health workers, very quickly now, what about for individuals? How many times is it too much to wash your hands?
It can never be too much to wash your hands. But I'd like to make a distinction here. The way you need to make your hands safe when you're administering healthcare, there may be slight differences from the way you need to make your hands safe if you're in the public at home. We make that distinction. So the moments that one will need to do hand hygiene at home or outside the health facilities, anytime before you eat your food, once you get into your home, each time you think you have soiled your hands, anytime you have used the toilet or the restroom, school children, anytime they've come back from playing. So we do know all those moments. But in health facilities, there are what we call the critical moments, what we call the 5 moments of hand hygiene. These are the moments that have been identified that health workers, when they're administering care, must make their hands safe before they can interact with the patient. And these have been shown that if health workers diligently, using the right technique and the timing, then they can offer safe care.
All right. Thank you so much, Madam Tochi Okwa. She's the Head Department, Disease Prevention and Health Promotion, NCDC. Thank you for enlightening Nigerians on the essence of hand hygiene.
Thank you for having me.
All right.